Yeah, so I haven't done a vlog for quite a while, so I figured I should probably update you all. So I'm on chemo 3 now. I've had my third one last Friday, a week today. I gave my dad a rest on escort duty, and my good friend Michelle came with me. She was scared of needles, but I looked after her, it's fine. This time we didn't have to wait a crazy long time for a chair like we did last time. It's probably about an hour's wait, and then we went in and the treatment happened pretty fast this time. It's probably about an hour and a half when I was in the chair. It was my last type of the first type of 2 drugs, the FEC type, which is the one that's injected in 9 different syringes intravenously, because this type of chemo that I'm on is split into two types of drug, FEC, and then the last 3 treatments are with Taxotere, which is given to you in a bag rather than injected into the vein. So after every time I've had this first 3 type of chemo, I noticed that I get a horrible congested feeling in the top of my head and down through my sinuses, and that passes after 10 minutes, but that's one of the side effects of that drug. So apart from that, it's not too bad. Again, no sickness, so I'm really pleased with that. Slight feelings of nausea over the past few days. I've noticed that my appetite is sort of a bit up in the air. I still eat, but I sort of only fancy things that I probably shouldn't want, like scones. I've eaten plenty of those the last few days. I just don't want to eat fruit and vegetables, but I force myself to, but you just don't want it. Like, your appetite goes a bit crazy. And so do your hormones, apparently. I've just been feeling like quite, down really, as if it's the time of the month sort of thing. And that's, I believe, to be a consequence of when you come off the steroids. You have steroids given on the day of chemo, and then you take them for 3 days after. So once you've finished those steroids, I think you probably experience like a low feeling just being off them. Yeah, so also today is the first day of my low immunity week, which you have after every cycle of chemo. That's the 2nd week subsequent to your chemo, and so as I've mentioned before, it's when you're at most danger of infection, you have like a low immunity, etc. And to try and counteract that, they give you immunity booster injections, what I've called them, and I just had mine this morning at the GP because I haven't grown the balls to be able to administer it myself yet. But it's not just like a little insulin thing that you just jab it in and it's sort of done. It's an actual proper needle that you have to reconstitute and stuff. So, I think it's fair that a nurse would do it for me, because, no one really wants to inject themselves in the stomach. Yeah, so that was that. Also, 2 weeks ago I had genetic testing done, which is really important because young women who are diagnosed with breast cancer, if they have no family history, then they're not often given genetic testing as a service. But for me, I think they were really interested in pushing for that because I'm so young, because I'm 21, and that's ridiculously abnormal. So the genetic testing literally involves just taking bloods and going over my family history. So we look through all the generations that we know of. There is no breast or ovarian cancer that we know of. So, I mean, normally I wouldn't be offered the genetic testing, and I've spoken to women who haven't been offered, who are only in their 30s with breast cancer, and because they haven't got the family history, they're just not giving the genetic testing, which I think is ridiculous because it does have such an important bearing on future decisions, one being surgery. Now, if I come back with the BRCA2 gene positive, which is the breast cancer gene, then I will have to make some important decisions concerning these boobs, and whether the risk, which is 80% chance of reoccurrence if you have the gene, is worth it. And then obviously if I don't believe that's the case, then there's mastectomy surgery with reconstruction, and obviously that decision is one not to take lightly. So with the information provided from the genetic testing results, it's really important. So I'm looking to get those results in a couple of weeks, 2 weeks time, so I'll do a blog to let you all know. Obviously we're hoping that I don't have the gene, but if I do, then I do, and at least it's an answer. It's a reason why this has happened and occurred so young. So yeah, that was genetic testing. So obviously, just to finish on a different note, in terms of how you feel as a person on chemo and your emotions, like I've come to realise that they can be a bit more of a roller coaster than you might expect initially. You know, you have to fight the urge to just want to lay around aimlessly. You don't want to have to think, and the fatigue might possibly have got a little bit worse. You know, I find myself possibly needing a nap, but you know, I don't often give in to it. If I do, it'd be on a rare occasion. I like to keep going. Obviously I'm angry. I feel anger about this predicament and why it's happening, and I think it's important to face these emotions rather than to suppress them completely. So I'm here admitting to myself that I feel these emotions and not to wash over them. What's got to me a lot recently is how my lack of independence, going from my uni house, having a job, etc., to just almost feeling pointless, is something that you have to, you know, resist feeling, because it's not true. Like, a lot of friends have said to me, like, your job right now is to convalesce, to get better, and that's your important job to do, and to spread awareness, which is what I hope I'm doing through these blogs. So it's not all pointless, and it's a silly thing to say, use that word, but you do feel these emotions, and it's not all, you know, easy at all. It's not easy, but we have to keep going. I have a strong support group, and I'm grateful for everything that everyone said in their nice messages and comments and support for me, so thank you very much. This one hasn't been a very interesting blog, but I think it's full of lots of important information, especially with the genetic testing, so I hope that you'll tune in and see what happens with that. Okay, bye.